Hello, I'm Maria Hall-Brown, and this is LA Currents. Coronavirus, COVID-19, non-stop conversations, worldwide concern, and never-ending changes. There's a fine line between hysteria and solid information. But today we have some wonderful guests with us who are going to give us some solid information when it comes to how Los Angeles is preparing and is prepared. I'm delighted to welcome to this wonderful stage Aram Sahakian. He is the General Manager of the City of Los Angeles Emergency Management Department, and Joanne O'Brien, the City of LA's Personal Medical Services Administrator, and I also want to mention that you are an RN.
Thank you.
Thank you both for being here today. So on March 4th, Mayor Garcetti actually issued an emergency, a local state of emergency.
So an emergency declaration gives us the tool to better coordinate and obtain resources that are needed. It doesn't mean that we hit the panic button. It doesn't mean that we're scrambling. No. It puts the resources within our emergency operations center. It gives us the tool to bring in all the city departments and agencies together. It gives us the resources to ensure that our first responders on the first line have the personnel resources, they have the financial resources, because once you declare a state of emergency, you become eligible for reimbursement too, for the money that you're spending. And as you know, also the state of California declared a state of emergency.
It's not the regular flu. As much as people want to kind of compare and say there shouldn't necessarily be this heightened attention on it because more people die from the flu, it's the issue that we don't know enough about this virus yet to determine even whether certain populations are indeed at risk.
Correct. It's new to us. It's new to science, where I think the science industry is trying to catch up to it. We're watching it. We don't know exactly. We started out saying it's 14 days now in terms of being contagious, might be 27. You might have symptoms, you might not. So I think that's why we're asking people to do social distancing. This is a time where you don't shake hands, don't go into large crowds. Be a good hand washer, not just rinse. It's for 20 seconds. Don't forget about your thumbs.
Happy birthday twice.
Happy birthday twice. Don't forget about, in between your fingers, your fingernails, your thumbs. So hand sanitizer is good, but it doesn't take the place of old-fashioned, soap and water.
I'm actually going to pull out some props because, there's been a run on toilet paper, which is very odd, I think, but there also has been somewhat of a run on different sanitizers. Okay, so this was something I found that I thought was interesting. Right. This is, I don't know if you can see it, antiviral Kleenex. Says it's going to kill any virus within 15 minutes of use. How do we feel about that kind of thing? Do we think that that's something that we should have? Obviously, we got our Lysol wipes, we've got our hand sanitizer, over 60% alcohol, which apparently is an important thing. I've heard about hydrogen peroxide being part of this whole thing. Antibacterial hand wash, and then little wipes.
I'll start with the Kleenex.
Okay.
I think any Kleenex is good, and when you sneeze and cough, don't sneeze into your hands. Use a tissue.
Right.
Then throw that tissue away. Then wash your hands.
Right.
So any tissue will work.
Okay.
So that ends that.
There you go.
About hand sanitizer, it should be at least 60% plus of alcohol.
Right.
At least.
Right.
But it doesn't take the place of washing your hands with soap and water for 20 seconds. It's good when you're out and about, you're at the store, you just touched something, you want to wash your hands right away with the hand sanitizer.
Sure.
That's good, but when you get home and you have access to a sink with soap and water, then wash your hands.
Why is soap and water because this is a lipid, why is this?
Because what you do with soap and water, it's not only the soap, which kills most of the bacteria and viruses on your hands, it's actual friction. So that's why it's important to do the happy birthday twice,
Right.
for 20 seconds. And the tops of your hands, your thumbs, people kind of forget they just do this, but you got to do a thorough job. Don't touch your face, for sure, because if your hands are contaminated, have something on them, and you touch your eyes, your nose, or your mouth, you've potentially infected yourself. So it's really hard. All of us touch our face hundreds of times a day. And then if you're not feeling well, stay home.
Right.
I mean, all of us have been guilty of, we're gonna power through this, we can do it, but this is not the time to do that.
Well, I'm going to actually jump to something along those lines, because as employees, we now have rights that employers are being educated about in regards to staying home. And so is that part of an official policy that's going into place about employers should not necessarily require doctor's notes?
So employers should not create a situation to make an employee feel uncomfortable
Right.
to report to work, or complicating the situation by asking a doctor's note, immediately or 2 days after their absence. They should help the situation because it's an unknown, and the experts are making clear recommendations that sick people make sick. So stay home if you're sick. And of course, part of the coup plan of every department, every business, is to look at their critical functions and ensure that they provide telecommuting for non-critical functions. They will lessen the possibility of the spread by keeping people home.
How prepared are we legitimately in terms of personnel, in terms of hospital beds, in terms of, over-the-counter items for people to, be okay, in terms of law enforcement personnel? How are we? How is the state, how is the city of Los Angeles right now in terms of ramping all of that up and making sure that hopefully none of it gets used, but if in fact it has to?
Well, it's being ramped up. I can guarantee you that. Every stone is being turned. As far as hospitals, that's a county health question. This is not new to our hospitals. They've dealt with other pandemics in the past and other infectious diseases. They are looking at their planning. They are looking at their coup plans. I know that for a fact.
What about testing? Because not everyone should get tested. And do we have enough test kits if necessary? Because I know that that's been a problem. And how is the pace of getting those opportunities to be tested ramping up?
Right now, that's really a public health question.
Right.
But if we identify someone that we think has a potential exposure, we call them, they have access to the tests and the criteria to which someone can be tested. So it's this really good communication with the city, the outside agencies, the state, the county. We're all talking.
What are some other things that people should just be in their daily life aware of?
Stay away from people. If you're in a store, back up. Instead of standing right next to that person in line, maybe back up 6 feet. Sort of keep a 6-foot distance.
I'll give you an example. Last night, my grocery shopping was at midnight. I never go grocery shopping at midnight, but I was at Ralph's. It was empty. No one was there.
Wow.
I felt more comfortable. Usually, I go during the day, and it's packed. So a lot of it is also common sense things. But again, I'm going to point to the recommendations by the expert. We need to truly listen to them. And if we follow them, hopefully, this thing will get resolved quickly.
I know this sounds a little alarmist as well. Is Los Angeles prepared for a curfew or a quarantine?
I don't think that we will get to that point based on what you're seeing, based on the way and the measures we're implementing to mitigate it. But if there's that big if, county health makes such a recommendation, we will be prepared for it. Obviously, LAPD law enforcement will lead that operation.
What are some of the best ways people can keep up with what's happening in Los Angeles?
County of Los Angeles have a website. Our department, emergency.lacity.org. You can go there and receive a lot of information. And if I may plug in Notify LA, if you don't mind, if you subscribe to Notify LA, and the way you do it, you text to 888777 the word ready, then you will become part of this database. When we need to reach you and communicate with you critical information, then we'll be able to do that.
It's really nice to know that Los Angeles is as prepared as it is. So thank you both very much.
Thank you for having us.
And that's it for this edition of LA Currents.